I've had a number of patients that I've interviewed, talked to, connected with, built relationships over the years. Many of them are Lyme patients like yourself. And so many of them have similarities in their stories, but also incredible uniqueness in how it came about. And I know one of the things that when I was looking at what you had sent over was that you almost died from Lyme disease. And a lot of people, when they hear and they haven't spoken to enough people with Lyme or understood what it truly is, they just think, isn't that just an infection where you get a bug bite? A tick bites you, you take antibiotics, maybe it sticks with you a little bit, you need a second round, and you get over it. And I think there's such a misnomer about that, what is Lyme disease? And I think more people need to stop listening to what a doctor's idea of what Lyme disease is, or conventional medicines, we should say, and start listening to the stories of people afflicted. So I want to open up the mic now to you and just to share, what was your experience like? Because you said you almost died. That's serious, right? So what, go back to where it all started in a sense when you were diagnosed or had Lyme, and share that with our audience.
I think that's a great place to start, is the diagnosis part.
Yeah.
Right. We didn't really know what was going on. We knew something wasn't right with my body. I was having multiple asymptomatic symptoms that were dispersing through my body through a period of time that wasn't consistent enough to keep a medical journal of. I would say over the course of 18 months, I rapidly declined. I have been very athletic and healthy, working out. And then all of a sudden, my joints, specifically one knee, is swelling abnormally. I'm starting to get pain in my jaw. My little baby toe is starting to hurt. And so, you're going to each individual specialist. If my jaw's hurting, I'm going to a dentist. Now I'm being referred to an orthodontist. They put me in a set of braces. Hey, you have TMJ. My knee, I go to an orthopedic. Hey, you used to play basketball. You were a cheerleader. You're a dancer. Let's throw some cortisone shots in there. Your toe, I'm not really quite sure. So let me throw you over to a rheumatologist. So I think that's where it starts, right? That misdiagnosis piece of your body is giving you the appropriate symptoms, and you have to link those pieces together. And us as a society, we immediately go to our doctors. But these doctors have some blinders on because they're in their specialized medicine. Had maybe a few of them in the very beginning. And when I say very beginning, I mean 17 years of trying to figure out what's going on. That longevity of having a dis-ease multiply continuously in the body results in massive deterioration. So I think for me in the beginning, hearing the possibility of lupus, fibromyalgia, chronic fatigue syndrome, depression. They thought that I had anemia. I was anorexic. Just all sorts of different things. And I went with it because all of the symptoms did tie up to the way the doctors were presenting the pharmacology, the prescription that they wanted me to walk out of that office with. And I blindly did it because I was early in my 20s and I just kept popping pills for probably 7 years. I went through, a whole regimen of rheumatology courses, physical therapy, I did everything under the sun, and we really just couldn't, figure it out. And I chalked it up to, this is just my body, my life.
Now, that's a long time, 7 years, popping pills. There must have been the ups and downs of it, right? It wasn't all a downhill. So you must have had a little bit of hope here and there, going to someone, taking a pill, feeling better and saying, oh, we solved it, right? Were there like the ups and downs that most people talk about?
Yes, because in the beginning, some of the prescriptions did work.
Mm-hmm.
They may have been had an underlying pain relief effect. And in my mind, I assumed my symptoms were just disappearing, but they weren't. They were further migrating deeper in my body.
So you do this for a number of years. You jump from specialist to specialist. The symptoms pop up. Maybe they dissipate a little bit with a pill. They come back or they move around. Where was that point where you said, listen, maybe this isn't just my body and I have to do something maybe different. Maybe I have to go see someone outside of who I know in my, medical realm here to try and solve this issue, because enough is enough.
My husband and I became blessed, and we found out we were pregnant. And everything went well with the beginning testings that you do for pregnancy. And then when we went in for our 9.5 week ultrasound, the baby stayed in my fallopian tube. So it's giving a dose of methotrexate to stop the human growth cells. And then we went back the following week to still see a heartbeat. And so I got another shot again. And that is the normal treatment for an ectopic pregnancy. So now I'm moving into 11 weeks pregnant, which is very abnormal for an ectopic pregnancy. But the way the baby had embedded in my fallopian tube, in the ampular section, there was enough. Like if you understand the fallopian tubing, sometimes it opens up like a flower. And so where we had the implantation, it was enough where there was growth. But unfortunately, we had to do the self-injected laparostomy where they took out my fallopian tube. When they do that in the prenatal ward, they do the standard blood test in case you need a blood transfusion. And that's when they found a foreign bacteria and parasites.